Welcome to the Change Life Destiny podcast series. Are you frustrated with the challenges of navigating our healthcare system? We understand, and that's why we're committed to sharing insights into the latest advancements and approaches that are reshaping healthcare. Join us as we explore the stories of practitioners and innovators who are leading the way toward a healthier future. Let's dive in and learn together.
Well, hello, everybody. Welcome back to the Changing Life and Destiny podcast series. I am your host, Stephanie Hingstenberg, and today we are going to have a very special conversation with Mercedes Deal. Mercedes, thank you so much for being here with us today.
No, thank you. I'm so happy to be here.
Yeah,
I'm excited to.
It's going to be a good conversation today, I feel. So why don't we start by you telling us a little bit about your journey and how you found yourself in this health space?
Great. Yeah, I'd love to. So I have been a nurse for 12 years and a nurse practitioner for 10 of those years. I've always been really interested in all things health and wellness, but my own personal journey really led me to kind of create something different that I found was missing.
Okay.
So about 9 years ago, I made the decision to get a breast augmentation. And I was very happy with it. But 2 years after that surgery, I started experiencing these really strange symptoms. I would have this swelling all over different parts of my body. Yeah. And it was like very disfiguring. I mean, my eye would be extremely swollen, my lip would be extremely swollen. I would have to go on a heavy course of steroids. I would go to the emergency room. It was really frustrating. I went to every specialist you can think of, allergist, immunologist, rheumatologist, and they would do test after test and everything would come back normal. So I kind of felt like I needed to do my own investigating. And I stumbled upon a group on Facebook. So thanks to the internet
Right.
and there are people kind of reporting similar symptoms, I learned about something called breast implant illness. And it's really different for different people, but it can manifest with a bunch of different symptoms, including brain fog, fatigue, rashes, joint pain, muscle pain. And I pretty much hit everything on the list, but everything was quote unquote normal. And so that need to find a solution is what led me to functional medicine and to now have my own office where my patients are the patients who everything is normal, but you just don't feel right. That's what I'm here for because of my own journey.
That is incredible. I mean, it's so fascinating. I'm really, really loving the ability to speak to people like you who have had this unfortunate thing happen, but then you take it upon yourself to really look and dig a little bit deeper. And it is going to help so many more people because you do that. So again, thank you for all of that you do in order to get to this space. But this breast illness, it is fascinating to me because there are so many. I have my own story of deciding to get implants, but it was because of a genetic mutation. And so all breast tissue was taken away and reconstruction was done. I have personally heard of at least 5 women who have had similar situations. Maybe they've been told that they have some sort of autoimmune disease. Maybe they
Right.
bucket it into that category. Is that what you were finding? Were you being told that it was maybe some sort of autoimmune?
Yeah, I was being told, oh, it's autoimmune. Likely it's autoimmune. The labs don't really tell us much. They're normal, but this is what it likely is. There was never a concrete answer. And I appreciate you so much for sharing your own personal journey because I think that part of that conversation that you should have been able to have with a provider was what other options do I have? And I think that thankfully people are having these conversations and now you might know about another option, right? Like a fat transfer.
Mhm.
That could potentially be an option. But not a lot of physicians or medical providers are even talking about that because they don't accept this diagnosis.
Right.
And I think it's the patients themselves and a few physicians and surgeons who are willing to kind of go outside of the norm
Mhm.
and these conversations, and then you feel better. Like, I have been 6 months post-op now.
Okay.
I have
Great.
I know. I'm like I feel so good. I feel like myself again. My energy is back. My skin is clear. Every once in a while, I'll still have a small kind of little outbreak, a breakout, like of a rash around my neck, very small. But I will tell you that in the last month, I've had nothing at all.
Wow.
I know I feel so much better, and I know for a fact, I feel almost 100% certain that the reason for that is because I took out my implants
Right.
and because it was done correctly.
Mm.
Because there are different ways you can do it. You can have when I went to my consult, because I went to a few different doctors to get a consult for the explant, and some doctors just want to take out your implants, but what is recommended. And I've done a bunch of research on this, trying to find clinical data, PubMed, anything, and we really don't have a bunch of evidence. But the little bit that we do have of research, a little bit of research that we do have shows that number one, people get better results if it's been less than 10 years since you had your implants put in and you removed them. And I got so lucky because I was at the 9-year mark.
Right.
And that you need a complete capsulectomy. That means they have to remove everything, all that scar tissue around the implant. And one of the thoughts is, and I really believe this, is that your body creates an immune response to this foreign body and you become hypersensitive. So I would have a glass of wine and my face would break out in hives, or I would eat too much sugar and I would be swollen the next day, but I mean really swollen. It was very disfiguring and I could not live a normal life. And now, 6 months later, I'm like singing it to the rooftops because I'm like, this is real.
Wow.
I feel much better, and it's been the best decision I've made, I think, in my life
That's
to take that.
that's so incredible. And it makes sense. Like if your body, if you think about it, if your body makes if it creates sort of using this scar tissue as sort of a barrier, if you will,
Mhm.
to this foreign body within your tissue, it makes sense that if you remove that capsule, that tissue that goes along with it, then your body has even a better chance of fighting off or responding properly to whatever it is that you are surrounded by environmentally or food wise. So
Yes,
that
absolutely.
makes so much sense to me that you would be able to do that. Now in my case, it's a little bit different because they and I did this before a lot of other people were doing this. I did this, gosh, it was almost 20 years ago. So, we're past that 15-year mark when I really need to start thinking about this. But in my case, there's nothing left if the implants are removed, right?
Right,
So then
right.
that leads me to have that different conversation. And I will say, I will go back and give my doctors props. They did tell me there were three options. There was closure, the flap or the fat transfer or implants. And for my husband and myself, we talked about it, and this is what we chose to be right for us. Luckily for me, I've had none of those responses, right? That's
Yeah,
wonderful for me, but that is not every woman's story. And because this is a device that will give out at some point, it's a device. It is not regenerating anything.
right,
It will have to be removed. So then I do have to have that conversation about, well, what's next?
right.
So, and there is this beautiful movement of women who are doing the flat closure and speaking out about it,
Yeah,
which is wonderful. However, I'm sort of taking over the podcast a little bit, but I will say that this is the whole reason that I am so passionate about changing life and destiny. Because if I would have known when I was 33 or 32, when I found out about this genetic mutation, that there were so many other things that I could have done beyond mass surveillance or prophylactic surgery, I had so many more choices. But again,
yeah,
like you're saying, no one was giving me those choices. So I didn't know any better. Well,
right,
now, because of people like you, because of things like changing life and destiny, people have the ability to be empowered to make these different decisions. So, okay, so I've got to stop talking. All right. So,
I
What are some of your favorite, now that you've been through this and you've created this beautiful functional wellness space where people can come to you and ask these questions?
Hi, everyone. Roxy here with the Change Life Destiny podcast. Thank you so much for tuning in. We hope you're loving this episode. Just a quick note to let you know that if you enjoy the types of speakers and the content and the technologies that we're showcasing on this podcast, you will enjoy our Changing Life and Destiny conference, which happens annually in Dallas in April. And we'd love to have you there with us. Learn more at changelifedestiny.com and use the code podcast at checkout to get a very special discount. We hope to see you there on this movement to move our healthcare system to a preventative, proactive model. Now back to the episode.
What are some of your favorite, beyond, let's say that we know what explants are now, right? The removal of those implants and doing it in a certain way gives you a better result, right?
Right.
What are some of
Yes.
the other things that you like to advise people? Some of the other favorite holistic approaches that you like to advise people, let's say if they decide they don't want to get rid of their implants.
Absolutely. So I think this is, and you kind of touched on it, that need for personalized care, right? Who didn't have breast implant illness? That is wonderful, right? And not every woman will. But for those of us that do, number one, let's acknowledge that it's real.
Mhm.
Let's give the women who do have the symptoms that acknowledgement so they don't feel gaslit,
Right.
right? Like there's nothing wrong with you. This can happen. Number one. Number two, we have to address inflammation.
Mm.
So breasts for women are really tied to our self-esteem. At least for me, it was, and I did enjoy having my implants in, right? So for the person who's like, I'm not ready to take them out, that's okay. I hear you. And I think that's when we need to really talk to each person individually. And that's why I started Rever Wellness, because it's not cookie cutter. Rever Wellness is about finding a personalized approach for each person based on what they need. And it's different for everyone. But some things that I would say across the board I like to use that will address inflammation are a series of supplements and peptides, some that are FDA approved and some that unfortunately are not. And that's always part of the conversation I have with my patients. For myself, in my health journey, and what I use with some of my patients sometimes is something called Body Protective Compound 157, BPC 157. Unfortunately, it's not allowed by the FDA to be compounded anymore in an injectable form. However, it can be used orally. And I have seen that it helps with inflammation. Another peptide that I personally utilized in my health journey and in my recovery from breast implant illness, and that I do discuss with my patients, is something called TB500. And what's really great about it is that it can reduce inflammation, it can improve tissue healing. And so after a surgery like an explant, you have to think about the way your tissue is going to heal. Reducing sugar really helps with that, high protein diets. And then I utilize those peptides. I would implement those same practices for a patient who didn't want to remove their implants. Live a low inflammatory lifestyle, try to reduce sugar, reduce alcohol, which are all things that are breast protective anyways.
Correct. Like that
So-
sounds like something that a really beautiful gynecologist that has breast health in mind might suggest.
Right. Yeah.
Wonderful.
I wanted to, when we decided that we were going to have a conversation, I thought to myself, I really wanted to do a little bit more research just on what women need to know would benefit their breast health. And what we do know is that how you live your life, meaning the food choices that you make and the lifestyle choices that you make as far as nutrition and exercise, reducing your alcohol and being a healthy weight are breast protective. So just doing those two things, you can do so much for your health. You don't need to go spend lots of money on a million supplements. Start small and you're going to do yourself a big favor in the long term,
Yeah, absolutely. Absolutely. What are you finding with regards to exercise in your research?
So I think most of the research shows that the recommended amount of exercise is 150 minutes of moderate intensity exercise per week. However, I don't know about you, but I have two little kids.
Yep.
And some weeks that doesn't happen for me.
Right.
Or true exercise, right? Sitting on a on a bike or on a treadmill or in the weight room, that doesn't happen for me. That's just not going to happen. And so I tell my patients and I tell myself, I have this conversation with myself that some days exercise is going to look like playing t-ball with my son in the backyard.
Right.
And that's enough, right? As long as I get my heart rate up, I'm playing outside for 30 minutes, that's going to count towards something. And my patients, I tell them, that's going to count that for you because it's going to make you feel good about yourself. It's going to make you feel like you accomplished something, even if it's not the traditional spinning class or weightlifting, it's still movement and it's still beneficial for your body.
Well, and there is so much to be said. So I'm a dance teacher. I'm a dancer. I've always been a dancer and I love taking dance classes as well. And so I really believe in the power of dance as exercise as well, but it's more about getting your body moving. It's also about what's going on in your mind, in your heart, in your soul while you were doing those things. So I think you just hit the nail on the head that we have to count the things that count and feel good about the fact that we are moving our bodies in whatever form or fashion that may be, because there is so much also to be said for our mentality, our stress levels, our anxiety. And it does, you kind of counteract it if you are consistently thinking, well, I'm not on the treadmill. I did this, but it's not that. Well, you just kind of canceled everything out of your mind. And that stress response and anxiety can make it can do a world of hurt, a world of hurt.
Big time. I was doing a presentation for some colleagues that I mentor just to help them with understanding better how to treat women and women's hormones. And in preparing for that presentation, something that I found, which is also really cool, is our stress response can actually delay ovulation. There is such a relationship between our pituitary, our hypothalamus, our cortisol, our women's hormones. All of that is intertwined. And if we don't, I think it's so important to be kind to yourself because why are you going to add that extra layer of stress? Stressing yourself out is going to negatively impact everything else. And so it's like I always say Monday morning reminder, be nice to yourself, right? Be nice to yourself because, it's hard out there and not everyone's going to be nice to you. And, everyone's hurrying to get to their next location or doing what, their priority is. And sometimes you have to stop and say, hey, I'm enough or, what I did is good enough. And it's like that coming from a place of self-love and self-acceptance as opposed to trying to change yourself is really powerful. And unfortunately, I feel like so many women, we've been trained that you exercise to be skinny. You fit into those Calvin Kleins. Like you need to work out so that you can fit this mold instead of saying you should exercise because it's good for your brain and it's going to make you strong. And if you're strong, you're going to be able to pick up your kid. Or if you're strong, you're going to be able to, go help someone in need. If we just change the why behind it, it's so much more powerful because skinny only gets us so far, that kind of mentality.
And there's so many people that are walking around that are skinny fat that have a ton of inflammation, but they just don't know because they are thin. And so from the outside, you just don't see it. Oh my goodness. Right. Okay. So we could talk about so many things. So, because I definitely want to touch on, the later in life, the menopause section as well. But so let's talk a little bit about, we've talked about, keeping yourself, but keeping yourself healthy, the breast implant illness. Let's talk a little bit about menopause. What are you seeing with perimenopause and menopause? Because I am certainly hearing more and more people that are actually talking about it and they're actually bringing real life data and resources for those of us that go through it, which is everyone. It just so happens that I went through it much earlier because I forced myself into it. But there are some real things that need to be discussed and information that needs to be shared outside of the gynecological office so that women can live a happier and healthier life in those later years. What are you seeing there?
Yeah. I mean, I think one of the biggest things that I see in my perimenopausal women is they come in and they tell me, I don't feel like myself. I'm exhausted. I'm gaining weight. I'm angry all the time. This is not me. So when people come in to see me, although the Menopause Society doesn't necessarily recommend that the patients have blood work done, I encourage all of my patients to have lab work done. And the reason why is because I see that so many of my perimenopausal patients are iron deficient anemic. They have anemia, their B12 levels are low. And so if I'm able to put them on iron, improve that anemia, they are going to feel better. Another thing that I really love to do for these perimenopausal women in that transition phase is support them with progesterone.
Really?
They're not having efficient ovulation. And so they're having these erratic levels of estrogen, not enough progesterone, and it makes you feel anxious. It doesn't let you sleep. And so progesterone is a very safe hormone when used correctly. Micronized bioidentical progesterone is very, very safe. I believe there was a study out of Switzerland, and I'm going to find it and send it to you.
Please
So maybe you
do.
can
And yeah, we'll put it in the show notes.
and they studied bioidentical micronized progesterone in perimenopausal women. And they acted for 5 years. And over those 5 years, they found that it was not bad for the breast. There was no negative outcome in the breast. They did find, however, at the dose that they tested, that there wasn't sufficient endometrial protection, right? That means that estrogen has kind of growth fact. Estrogen is a growth hormone, right? It causes proliferation in the uterus. And we need progesterone to kind of calm that proliferation down, calm that growth down. So the estrogen causes growth and the progesterone says like, hey, calm down, let's go. And so when you don't have enough of that in the perimenopausal transition, it can actually be bad for your uterus, bad for your cervix. It can cause too much growth. And I think that we need to have this conversation with our patients and let them know if you're having these really, really heavy periods, that's not normal. If you are really moody and anxious, that's also a sign that you're not having sufficient progesterone. And so I would say that those are the top two things that I do address with my perimenopausal patients. If I was going to like give you like a quick and dirty, right? That would be
Yeah.
it. Would address the anemia that I see so often and support them with progesterone. And then obviously there's different things that each patient gets that's unique to them, but that's really, really common. And I'm seeing that a lot in the perimenopausal transition. Iron deficiency anemia, low progesterone levels. And by fixing and addressing these two things, patients feel so much better.
Right. And then, there's a whole host of things that go on after that. That if you're addressing these things early enough, then and considering to having a lifestyle shift that really is health inducing, let's say healthy inducing, then you're just setting yourself up for the rest of your life to be just happy and healthy, which is really wonderful. Okay, so can you share maybe some stories of change that you have found in your clinic that are just highly inspiring and could help any of our listeners to make that step, maybe to maybe give you a call or maybe give someone else a call that they need?
Yeah, I mean, I would recommend you can always find through the Menopause Society. I am a Menopause Society certified provider. There's so many of us out there now, thankfully, that are kind of leading the way and advocating for change for our patients. And I'm really proud to be doing that. I have a few stories because I do think that when you're able to help patients in the way that I do, and I'm really proud to say that because I put so much love into what I do. And when these patients feel so much better, they're your patients for life, right? So I actually had one patient, and this is not a perimenopausal patient. This is actually a younger patient who came to me very anxious because she went to see her primary care and she was diabetic. She had been diabetic. She was type 2 diabetic. And she was so afraid. She was so nervous. She was told to go on Ozempic and they put her on the highest dose right away. She felt sick. She was vomiting. She just says she has PTSD about the medication. So when she came to see me, we had to undo a lot of trauma, I think, that was caused by that approach. And we approached it in a different way, a bit more holistic, looking at a combination of supplements, lifestyle changes, mindset shifts, which are so important, and then low dose GLP-1s. And now she's hemoglobin A1C is perfect. She does not have diabetes anymore. And she's hopefully going to plan for baby number 2 in the future, so that's really exciting for her, right? And
Huge.
we're treating disease and reversing disease, which I don't know why people say that it's impossible, but it is very possible.
Well, I have some guesses as to why people say it's
Yeah.
impossible. I think I've heard and spoken to enough people in this industry and in this functional space, and I kind of have some clues as to what it could be. Wonderful. That is so fantastic for your patient. Any others?
So I have a few perimenopausal peri stories, I like to call them. I have a few peri patients that we have done really small changes and they just feel better. I would love, like, I can name a few different unique instances. So I have a patient, she's very social and a lot of her job is being in front of people. But she started having this crazy anxiety and irritability that came with perimenopause. She's like, I want to punch everyone. I just feel so grumpy. And she's like, I can't do this because my job is to talk to people. I can't be this raging crazy lady. That's literally what she told me. I can't be this raging crazy lady. I need help. And what we did was so simple. We just put her on progesterone. That's it.
Wow.
And she feels like herself again. She's sleeping again. And so it doesn't have to be this crazy change. It can start so small as long as your provider knows what they're looking for and the patient is open to working with a provider that kind of having these conversations, you're going to be successful.
Yeah.
Uh, I always tell my patients, give me a year of your life.
Mm.
I ask, give me a year. And the reason why I ask for a whole year is number one, change doesn't happen overnight. Number two, the hardest thing that we work on changing is the mindset. If you go to a lot of traditional offices, they're going to give you the prescription for whatever you're asking for because we don't have the time in the traditional medical system to do the mindset shift. But when you shift your mindset, which is what I do with the majority of my patients, they come see me once a month, right? And with the work that we do in these mindset shifts is life-changing and it's long-term change, not a quick fix, long-term change due to small shifts in the mindset, like very tiny things that we do over and over again. And when patients start with me, one of the activities that I have them do is stand in front of a mirror and tell yourself something that you love about yourself. And they hate it. They hate it when we first start. They literally tell me, this makes me uncomfortable. I don't want to do it. It feels icky. And I kind of turn it around to them and I say, if this was your best friend, what would you tell her? Pretend you're talking to that best friend. Don't feel like you have to write a love note to yourself. Just talk to yourself like you would a friend and make that person feel good for a moment, not by telling them inauthentic things, but things that are actually good about you. And that little shift helps a lot.
Isn't that interesting too? It fascinates me because I think that we have just been, as a society, sort of programmed a little bit to not allow these very important love what is the word that I'm looking for? We've been programmed to criticize, right? We've been programmed to criticize. So those of us that cannot simply look at ourselves in the mirror in a loving way, it might have so much to do with just things that we've been told that we're supposed to think.
Yeah.
And so the critical thinking part of us and those independent thinkers that can come in and say, no, hold on. Does that serve you? Because if it doesn't serve you, then why are you doing it? And
exactly,
that certainly helped me along my journey. That's for sure.
Me too.
Okay. So, I mean, listen, Mercedes, we could just sit and talk for ages. I love the work you're doing. I think it's super, super important. And I think that more of us are getting louder about these very, very important details of our lives that need to be shared. We need to talk about it because if we don't, then other people don't learn anything. And we're always just going to perpetuate this same conversation. So I just thank you so much for that. Now, you have made this huge step into the functional wellness space. And so when it's concerning root cause, when it's concerning prevention, when it's concerning sort of reversing some of this mentality and really promoting healthy lifestyle, if you could dream, what would be your dreams and aspirations for the future of healthcare?
ugh, I wish that everybody could have access to this type of
Mm.
care. I wish that we could all have root cause healthcare. And I wish that it would be supported by the bigger hospital systems. I know that it's an investment for patients when they come and see me. I'm aware of that. And I don't take it lightly. And I tell them I wish that it could be different. So in my perfect world, I always tell my husband and he laughs. I say, in my perfect world, if I won the lottery, I would do this for free. I would, because I love it so much and I see the changes and the impact it makes in people's lives. And truly it makes me emotional because I I really would do this for free if I could. And I wish that everyone had access to it. And I wish that they can experience it because once you address, you find the root cause of why you feel the way you do, it's like the light turns on
Yeah.
and you can start feeling whole again. You can start feeling like yourself again. And so many of us are walking around unhealthy and sick and they're doing their best.
Yeah.
They don't know that there's another
Yep.
way. So in my perfect world, I'd win the lottery and I doing this for free.
I love
Promoting it
it.
well, and I think that's part of why for me, I have kind of started educating other providers because I know that I can't help everyone.
Right.
I would love to,
Right.
but I can't. And so if I can help my colleagues better serve their patients, then I think that that's a step in the right direction.
Absolutely. I couldn't agree more. And I think that there's also a very massive conversation that needs to happen about insurance and about the types of insurance and about the mindset around how you pay for insurance, because there are solutions there too. But that's a completely different podcast for another day. Oh, well, thank you so, so much for your time today, for your talent, for your perseverance in your own personal story to get you to where you are now so that you can help so many people. Even if you don't think that it's enough, I'm sure that your patients would disagree and your colleagues would disagree. So thank you for all of your time.
Thank you, Stephanie, for letting me sit here and talk with you about my experience and just for being so open and sharing your own experience. It's been really lovely.
Absolutely. And for those of you that are listening, make sure you check out our show notes because we will put links down there on how you can get in touch with Mercedes yourself.
And I'll send you that research on that
Yes.
testosterone study as well. So you can
Perfect.
link it there.
Wonderful. Have a great day.
Thank you for tuning in to the Change Life Destiny Show. We hope you found today's conversation enlightening and empowering. Be sure to join us each week for more thought-provoking discussions and inspiring stories. Don't miss out on staying up to date with the latest in healthcare innovation. Subscribe to our podcast and visit us at changelifedestiny.com to explore more about the practitioners, technologies, and how you can take control of your health journey.